Hi everybody, it's Jessica with Pilates Happy Hour. Today we are going to be talking about knee strength. So it's one of the most common things I see as a physical therapist is what we call anterior knee pain, chondromalacia. There's a lot of different names and different issues that can go on here. So again, always make sure you check with your doctor, see a physical therapist if you are having knee pain. But this is just going to be a general routine that you can do to help strengthen a specific muscle around your knee that's going to help make sure that your kneecap is tracking correctly. So I'll kind of talk you through that as we go, but we're going to go ahead and get started. The first thing is called a quad set. So it's a really fancy name of basically, or a really fancy way of basically saying that we're going to tighten your quad muscle here, which is your thigh. There are 4 different parts to your quad muscle, and the one we're focusing on is called the vastus medialis oblique. It's the one that sits on the inside of the kneecap. So I don't know if you can kind of see, but right here is where the vastus medialis oblique sits. Okay, and so what tends to happen when people get knee pain is the kneecap ends up not tracking correctly and it pulls too much laterally. So we want to work a little bit on getting it back to center, which means we're going to work some of those medial muscles that attach to the patella to start. So a quad set just means you're going to sit with the legs straight out in front of you and you're going to tighten your quad muscle. So all I'm going to do is squeeze right there. You might be able to see it contracting. It might be kind of hard to see that. You might see my heel lift a little bit off of the floor, and then I'm going to relax. So again, I'm going to tighten right here. I'm going to hold that 10 seconds. So that's called a quad set. It just means you're tightening your quadricep muscle, holding it 10 seconds. You can kind of check and make sure that your toes are facing straight up. You know, I don't want them flopped out to the side. You can also make sure what you're trying to do is kind of think of the back of the knee is pressing down to the floor. So that might help you to think about that. You really want to tighten that and hold it 10 seconds. I recommend doing all of these on both legs. If you have an issue on one knee, who knows, maybe it'll come up on the other knee at some point. So go ahead and do both. If you don't have time, no big deal. Just stick with this one. So I want you to do at least 10 of those. Some people say to do 500 a day, actually. Again, check with your doctor. You just want to think about doing these throughout the day is what I tell people, okay? So tighten that, hold it 10 seconds, and relax. So that's your quad set. Next, we're going to do what we call a short arc quad. So I have this handy foam roller I'm going to use. If you don't have a foam roller at home, you can take a big bath towel and roll it up. Also, what works awesome is to take an empty paint can and just put a towel around it. That works well. An old coffee can would work really well. And then you can lay down on your back. I used to tell people coffee can all the time, and now everybody uses Keurigs, so there's not really coffee cans around much anymore. But you're going to be here with it right behind the knee. Same thing, pull the toes back towards you, and then just lift. Hold it just a few seconds, just nice and slow, and then lower it right back down. So that's called a short arc quad, is what we call it in physical therapy. Lift. Make sure, again, you're tightening here. Okay, so tighten your quad, just nice and slow, and back down. And you would do 10 to 20 of these on each side as well. Again, if you were my patient, I would tell you to do probably 50 of the quad sets a day and 50 of these a day. And then lower. And then do both sides. All right? So lift, tighten, and back down. So that's your short arc quad. So next we're going to do a straight leg raise. These are getting progressively harder. So if the straight leg raise isn't going to work for you, just stick with those 2 and come back to it later. So I'm going to have you back on your elbows. Again, straighten the leg out, pull the toes back, tighten the quad. So do the quad set first here, then lift your leg. And you're only lifting it about 30 degrees off the ground. And again, nice and slow. You don't have to hold this one like you did the first one. So tighten first, toes pull back towards you, lift your leg, just nice and slow, and back down. Again, working the quad and then getting into hip flexor a little bit, your rectus femoris. Just make sure you're not lifting all the way up here. Okay, that's not gonna do much more for you. Just lift to about 30 degrees. That's going to be the most effective way to strengthen that. You can do this laying down on your back, but I'll be completely honest, from a Pilates and physical therapy standpoint, it's a lot harder on your abs, actually. So you can do it, but I prefer to have somebody propped up a little bit because then you can really just focus on that leg. I love working the abs, don't get me wrong. But if we're really doing PT just for the knee and I want you to focus on that, I'm going to start you here. Or just prop yourself up on a few pillows, maybe. That might do the same thing. Okay, so last exercise, that was 3. We had the quad set, the short arc quad, straight leg raise, and then I'm gonna show you a clamshell. You're gonna lay down on your side. So you are gonna think, oh, what does this have to do with my knee? A lot, actually. We're gonna work your hip abductor and rotator, which is your gluteus medius, and I'll tell you about that in a second. Pull your belly in, stack your hips, knees are bent, feet stay together, and you just lift your top knee up and down. So your hips stay stacked. I don't want your hip rolling back, okay? So keep the hips stacked, keep your feet together, and you're only lifting this knee as much as you can without the hip rolling back. That's the key. If the hip rolls back, it just means it's not a hip rotator exercise anymore. So what we're doing, if you go back to what we said at the very beginning about trying to get that kneecap tracking correctly, in my experience, inner and outer thigh muscles, your hip ab and adductors, are huge components to getting that kneecap to track correctly. So we're just starting to get a little strength into your hip abductors, your hip external rotators here. So these two, I would start with maybe 10 or 20, see how it feels, and do that a couple times a day. So you're maybe doing up to 50 a day on each side. And again, my recommendation is to do all these on both sides, just so that you're even. If you have time, that's what I would do. And there you go. So that is kind of a beginner knee strengthening program that you can assume might help just about any knee issue that you're experiencing. But as I always say, please check with your doctor. Go to physical therapy. It can really help. There could definitely be other issues going on there, but that'll give you a little beginner workout for those knees. Thanks so much, everybody.